Hi dear friends, welcome back to Curious With. I am Dr. Mosina. Today we will see one disease of exotic species, but this is very important disease as far as veterinary licensing exams are concerned. It is Aleutian disease of mink. So let's begin. Aleutian disease or plasmacytosis is a parvovirus infection. So this is a parvovirus infection characterized by poor reproduction, gradual weight loss, oral and GI bleeding, renal failure and uremia, and high mortality. You can see the picture of a mink here. So this is a disease caused by parvovirus. All color phases of mink may be infected, but light color phases, they are genetically derived from Aleutian color phase, are more susceptible. So in the picture here you can see the dark and light colored color phases of minks, and the light color phases are genetically derived from Aleutian color phase are more susceptible to this disease. The causative parvovirus is not related to mink viral enteritis. So this parvovirus is not at all related to mink viral enteritis. And transmission occurs in utero and by direct or indirect contact with infected mink. After infection, immunoglobulin levels of the infected animal frequently increase markedly, and immunoglobulins are unable to neutralize the virus. So what happens? Immune complexes form and deposit in various tissues, resulting in immune complex glomerulonephritis and arteritis. Now let's see the gross pathological changes. Gross pathologic changes include splenomegaly, renal changes varying from swelling, petrification to atrophy and pitting, and enlargement of mesenteric lymph nodes. So here you can see the renal changes. There is enlarged pitted, pale, tan kidneys seen in advanced case of Aleutian disease of mink. Coming to the histopathology, histologic lesions include mainly plasma cell infiltration in kidneys, liver, spleen, lymph nodes, bone marrow, etc. And there will be bile duct proliferation, membranous glomerulonephritis, and fibrinoid arteritis. So this is the lymphocytic infiltrate of portal triad inside liver associated with Aleutian mink disease virus. Kids from dams negative for Aleutian disease virus may die from acute interstitial pneumonia. Now let's see the diagnosis. Aleutian disease is controlled through a test and slaughter program. So that's very important. Positive mink are identified by blood testing for specific antibody, by counter immunoelectrophoresis or lateral flow ELISA. All positive mink should be culled. Mink to be kept for breeding stock should be tested in late fall, that is before selection of breeding stock and pelting, and in January or February, that is before breeding. So mink to be kept for breeding stock should be tested in late fall and in January or February. New introductions to the herd also should be tested. Genetic selection of resistant mink using a quantitative ELISA and or iodine agglutination test is being used to increase survivability and reproduction. These tests identify mink with hypergammaglobulinemia for culling. So, test and slaughter policy is used in this disease. The quantitative ELISA identifies overall antibody levels to Aleutian virus, allowing mink with lower antibody levels to be selected for breeding. Prevention and control measures. So the thing that we should remember is there is no vaccination or effective treatment for Aleutian disease of mink. And virus is present in saliva, urine, feces and blood of infected mink. So what are the prevention and control measures? Pens should be steamed, cleaned and dipped in or sprayed with 2% sodium hydroxide. Equipment should be disinfected after handling, vaccinating or testing mink on infected farms. Raccoons and flies may serve as vectors and their control is essential. So that's all about Aleutian disease of mink. So the important points to be remembered is it is caused by parvovirus and gross lesions that the disease makes. Then the diagnostic techniques and testing and slaughter policies used to control this disease. And so that is all about Aleutian disease of mink. If the video is informative, please like it and share it with your friends and comment your suggestions. If you are new to this channel and not subscribed yet, please subscribe and click the notification bell so that you get notified every time I upload a video. See you soon with another video. Thank you. Bye.